So today I'm going to show some of my pictures that I have pre and post-op of my foot. I'm only 3 weeks in, so it really isn't that much, but here it goes. So this is my foot pre-op. This is the day I went in for the consult. So as you can see, I operated my right foot and you can see that profound bunion. It's about moderate. It's not considered severe. Mild to moderate, really. This is my left foot, which also has a bunion, but that definitely is considered that mild bunion. They both experience pain. The right foot more than the left. The doctor said that perhaps the left was starting to feel pain because of me putting so much pressure on the right foot. So then I was, to relieve the pressure, putting pressure on my left foot and then relieving pressure from my right and increasing pain in my left. I noticed the pain the most when I went to a conference this year in California. It's called the Evolution of Psychotherapy Conference. I'm a counselor. It's a great conference, so definitely recommend it if you're a counselor. But I was walking around for about 5 days to different locations on the campus, and it was just excruciating pain. By the time the 5 days were over, I really was looking at people with walkers with envy because I wanted a walker or a cane to help me. It was that much pain. This is a different picture where you can almost see that big difference there of the bunions. And the right bunion is the one I had surgery on. This is my left bunion. And you can see it right there. That bigger growth of that bone. And also the separation. But you can see here that there's still some space between the two toes. So it's less of a profound bunion. In the next slide, you'll see my right. It's not completely indicating, but you can see the bunion is much bigger if you look at both in comparison. So smaller bunion, and this one's definitely larger. And this is where you can see that separation much bigger, and this toe is basically right on top of that other toe. Not over it, but right next to it. And that's where the bunion was. And the doctor actually found that there was a bone cyst when they did the surgery. So that would have increased inflammation and increased pain. So that's my left. You can see that there's separation. It's a little less. And then you compare it again to the right. It's a lot bigger. And the separation is almost none. So this is post-op. This was 2 weeks post-op, and I'm not sure if they had already taken out my stitches, but this was the appointment to take out my stitches. You can see that there's some bruising, and that's totally normal. And the doctor said it was a little swollen. I don't know if you can tell in the video. It's a little swollen, but it's like normal swelling. He said it was doing great. The next picture I'm going to show, not doing so great. It was about 3 days ago. Ever since the stitches have come out, you can shower, and I have been showering with the foot out. And I also made this mistake of putting Neosporin on it. I just thought it would be good and, you know, proactive, but it kept it way too moist, and you can see it in that picture. It's really ugly. So if you don't want to see an ugly picture, stop the video now. So that was 3 days ago. It's pretty gross. It's not infected. It wasn't, at least from what the doctor said. He didn't think it was infected. It's just kind of like white skin, like when you leave a Band-Aid on all day or something like that. And I also did have bandages on it, like Band-Aids or gauze, and then I had it wrapped because I was going to work every day, and then I had to do that to wear my boot. So on top of the Neosporin, I was putting Band-Aid on it and wrapping it, so it was just keeping so much moisture. And it really wasn't helping with closing. It was just really wasn't doing well, and it was actually a little more painful. So I called the doctor, showed him the picture, and he sent me some preemptive antibiotics just in case, because it did look a little red here. But it wasn't warm to the touch. There wasn't any pus or anything coming out of it. It was just like white skin. But I did use 2 products that were recommended to me by a Facebook group, Bunion Surgery Facebook group, which is this one. Bunion Surgery Foot Surgery Support Group. So it's a really great group, and there's about I don't know, 956 members. And it's a closed group, so you get a lot of great comments, all for people who've had surgery or are having surgery. But they had recommended me to use this betadine, and I called the doctor, and he also was in support of it. It's a great antiseptic. So I was using that and applying it with either gauze or with a Q-tip. And I've also been using this, which my doctor recommended and the groups recommended, Hibiclens, or Hibiclens. It's a antiseptic skin cleanser. It's actually used by doctors to scrub before surgery, and by, you know, the nurse and everybody in different health professions. They use this when they're washing their hands before surgery or different procedures. So I've been using those two products, this to clean, and this afterwards. I've just been applying it. And then I've been letting my foot air dry for about 15 to 30 minutes, maybe an hour at most. The doctor wants me to keep it wrapped so that I have compression and decreased swelling because I am working. He said that I could have increased swelling, so he just wants me to keep it wrapped for that reason. So a lot of people said to leave it out in the air, but I'm following my doctor's orders, of course. But you can see it's a big difference today. The orange tint, that's from the betadine. It's like iodine, so that's what it looks like. But you can see if you look up close, much more closed. It's not as, I mean, you can't really tell the difference in color, but it's just looking a lot better. If you compare it to the other picture, it was kind of just not closing and not looking great. And so big difference. And I mean, I'm hoping that I continue with my progress. There's always going to be some hiccups along the way. So this was my hiccup, that ugly picture. But hopefully things will go well and I can keep you updated. Thank you. Have a great one.